Good morning everybody. I am Dr. Nitin Joshi Professor in urology with teaching experience of 25 years working as consultant neurosurgeon in Conway. Today we will discuss embryology of the prostate, which is important from the point of BPH as well as TURP. Prostate is a derivative of primitive endoderm, that is primitive gut tube. The primitive gut tube differentiates into foregut, midgut and hindgut. Cloaca is a part of hindgut. Cloaca is like a dilated chamber. In 5th or 6th week of intrauterine life, there is a development of a septum called as urorectal septum. Urorectal septum divides cloaca into larger ventral primitive urogenital sinus and smaller dorsal anorectal canal. At the same time, that is 5th to 6th week of intrauterine life, in the thoracolumbar region, there is a development of tissue called as mesonephros. Mesonephros is functional tissue in intrauterine life. Its tubules and ductules, they drain into the mesonephric duct, which is also called as Wolffian duct. The Wolffian duct or the mesonephric duct elongates to drain into the primitive urogenital sinus. Due to draining of mesonephric duct into primitive urogenital sinus, the primitive urogenital sinus gets differentiated into cranial vesico-urethral canal and distal, that is definitive urogenital sinus. The vesico-urethral canal develops into bladder and proximal part of the urethra, that is proximal prostatic urethra. The opening of the two mesonephric ducts in postnatal life marks the opening of two ejaculatory ducts. So the proximal part of the prostatic urethra originates from the vesico-urethral canal, and the definitive urogenital sinus gets differentiated into two parts, that is pelvic part and the phallic part. The remaining part of the prostatic urethra and the membranous urethra originates from the pelvic part of the definitive urogenital sinus, while the anterior urethra develops from the phallic part of the definitive urogenital sinus under the influence of the hormone testosterone secreted from the fetal testes. After the urogenital sinus receives, or the mesonephric duct drains into the urogenital sinus, after that, around the same time, that is 5th to 6th week of intrauterine life, there is origin of the diverticulum from the lower part of the mesonephric duct, which is called as ureteric bud. This ureteric bud then will be growing towards the metanephros to differentiate in the pelvic alveolar system. After the origin of the ureteric bud, the part of the mesonephric duct which is below the origin of ureteric bud and between the vesico-urethral canal dilates to form a common nephric duct or common excretory duct. This is because at this time the two systems are still opening in the common sinus, that is the mesonephric duct, which will differentiate into, after virilization, into epididymis, vas, seminal vesicle, and the ureteric bud will go towards metanephros and will be bringing urine. This right and left common nephric duct migrate towards midline and it gets absorbed into the developing part of the vesico-urethral canal. The part of the absorbed right and left common nephric duct in postnatal life contributes to what is called as central zone as per the McNeil's zonal concept. And so this glandular tissue of the prostate will be surrounding the openings of two ejaculatory ducts. After the absorption of the right and left common nephric duct, the two systems, that is the mesonephric duct and the ureteric bud, they separate from each other and they rotate and migrate in opposite direction with respect to each other. The first morphogenic change in the appearance of the prostate is the development of 5 different groups of the buds, which are called as the solid epithelial or solid epidermal buds, which originate from the epithelium. At this stage there is no urothelium, it is the epithelium of urogenital sinus. And the origin of, or the induction for the development of these 5 groups of the solid epidermal or epithelial buds is because of the stimulatory effect of the mesenchymal cells. In the process of BPH, after the age of 40, again it is the stromal cells which induces the growth of new glands, and that is growth of epithelial cells, and therefore BPH is also called as embryonic reawakening phenomenon. So in embryogenesis, it is the stromal component which induces the formation of 5 different groups of solid epithelial or epidermal buds which grow in the surrounding mesenchyme. In the 8th week of intrauterine life, the fetal male gonad, testes, starts secreting male sex hormone testosterone under the influence of hormone LH from fetal anterior pituitary, as well as beta HCG from the placenta of the mother. Beta HCG functions like LH, and thus the stimulation of interstitial cell of Leydig of the fetal testes, resulting into secretion of testosterone. There is a presence of enzyme 5-alpha reductase in the urogenital sinus. 5-alpha reductase is responsible for conversion of testosterone into dihydrotestosterone. Dihydrotestosterone is 10 to 13 times more potent than testosterone, which is responsible for the proliferation and development of 5 different groups of solid epithelial buds. These 5 groups of buds, they will be proliferating into the network of tubules and ductules, and they will be differentiating into the basal cell type and the luminal cell type phenotype, as well as there will be canalization to form the lumina. Simultaneously with the development of the epithelial component, the stromal component arise from the mesenchymal cells. They proliferate and differentiate to form the stroma, which is fibromuscular, that is presence of fibroblasts, which give rise to collagen and elastic fiber, and the smooth muscle cells. These fibromuscular stroma later on will condense to form a capsule. So it results into what is called as fibromusculoglandular organ called prostate, and the concept of the Laosley's lobar concept of 5 lobes originates from this 5 groups of epithelial buds, which originates from the embryonic prostatic urethra under the influence of mesenchymal cells. Thank you very much.